Hi, my name is Barbara Diane Gillis, and I am a senior neuroscience major. My research is on Alzheimer's disease and sleep fragmentation in different ages of transgenic mice. My mentor was Dr. Michael Murphy. Alzheimer's disease is one of the most common neurodegenerative diseases, and it is the most common in elderly patients. In 2012, it was estimated that 5.4 million Americans were living with the disease, and the risk for women is higher than that for men. This all makes it important to study Alzheimer's disease. The pathology of AD begins with amyloid precursor protein, APP, being cleaved by beta secretase and then gamma secretase. This produces amyloid beta. Amyloid beta can either be 40 amino acids long or 42 amino acids long. The 42 version is very insoluble, and this is the main protein that causes neuritic plaques, as this form of amyloid beta aggregates in the brain. Amyloid beta is seen in the bottom photo. Tau is seen in the top photo. Tau is a protein that normally stabilizes microtubules and becomes hypophosphorylated in Alzheimer's disease, forming neurofibrillary tangles, which are shown in the very top of the top photo. Neurofibrillary tangles are the main cause of cell death and neurodegeneration, and it's why you see a cognitive decline in Alzheimer's patients. One of the most common symptoms of Alzheimer's disease are sleep disturbances. This symptom often presents before cognitive decline begins. Patients often are unable to fall asleep or are awake at odd hours of the night. Overall, they have reduced sleep and increased nighttime activity. The suprachiasmatic nucleus, or SCN, controls sleep-wake cycles, and it has been shown in post-mortem Alzheimer's patients that the SCN has degradation and a higher ratio of glial cells. This causes less neurotransmitter to be released and for circadian rhythms to become abnormal. The mice used for my research are triple transgenic, meaning they are heterozygous for 3 mutant alleles. Amyloid beta begins to appear in the amygdala and hippocampus by 6 months of age, and hyperphosphorylated tau presents at 9 months of age. Previously, 3-month-old transgenic mice underwent a sleep fragmentation protocol for a month. The sleep fragmented group, or SF group, had more activity during their sleep cycle, and they were unable to achieve the same amount of sleep as a control group. The SF group was found to have significantly higher levels of total A beta, which was hypothesized to be caused by a decreased clearance of A beta due to a lack of sleep, which caused increased AD pathology compared to a control group. I assisted with 2 groups of transgenic mice, one 8-month-old and one 12-month-old, which underwent the same sleep fragmentation protocol. Sleep fragmentation occurred 4 times in a day for an hour each. Each time we entered the room, stimulated the mice with toys and activities, and left a control group, an unstimulated group, or US, alone. Then, each brain was pulverized, homogenized with diethylamine extraction buffer, or DEA, and centrifuged. A supernatant was taken off. This was followed by homogenizing with a RIPA, RIPA, extraction buffer, and centrifuged again. The supernatant was again removed. This was followed by a sonication with formic acid, and this was ultracentrifuged. Again, the supernatant was removed. This supernatant was then used in an ELISA immunoassay to quantify the amount of amyloid beta in each brain. This graph is showing the sleep fragmentation. The blue shaded boxes are the 4 periods when we went in and stimulated the mice, and the blue line is the sleep fragmented group. This just clearly shows that they had more activity during their sleep cycle than the unstimulated group. These are the results for the first extraction using DEA. The graph on the top left is a comparison of amyloid beta 40 and 42 in the 8-month-old mice. The graph on the bottom left is just the total A beta from the 12-month-old mice. An unpaired t-test was used to find significant differences between the unstimulated group and the sleep fragmentation group. Significant data was found for amyloid beta 40 and for both the cortex and hippocampus of the 12-month-old mice. These are the results from the second extraction using REPA. Significant data was found for the top right graph, which is from the 8-month-old mice, and this was a comparison of amyloid beta 40 and 42 for the control group US and the sleep fragmentation group. Both graphs on the left are from the 12-month-old mice total A beta. No significant difference was found between the control group and the sleep fragmentation group. For the 8-month-old mice, there was a significant difference in amyloid beta concentration for the DEA and REPA extractions, comparing the control group to the sleep fragmentation group. In the 12-month-old mice, significant data was only found for the DEA extraction, not from the REPA extraction. Therefore, sleep fragmentation affected all of pathology in the 8-month-old mice for amyloid beta, but only affected the most soluble amyloid beta in the 12-month-old mice. Disrupted sleep cycles play a larger role in pathology development in young mice rather than older mice. Sleep may play an important role in the development of the initial pathology and clearance of slightly soluble amyloid beta, but does not affect the advancement of pathology once it has already become severe. Additional sleep may not make a difference in clearance rates of older mice if the amyloid beta is already too insoluble and concentrated. In the future, this study should be replicated in humans to see if it is applicable, and tau should be examined next time. This research could be expanded to study sleep enhancement as a treatment for preventing Alzheimer's disease or slowing its progression in middle-aged adults. This is my works cited. Thank you so much for listening and have a great day.